Limb deformities are complex conditions in dogs and can cause significant pain and difficulty if not treated. The radius and ulna bones are the most commonly affected, often due to uneven growth between these paired bones. This can result in significant angulation, rotation, and even joint problems.
Correcting these deformities requires meticulous planning and precise execution in the operating room. Historically, planning has involved methods like the center of rotation of angulation, often using two-dimensional radiography. While computed tomography imaging is also used, current methods still frequently rely on resolving complex three-dimensional structures into two-dimensional images for quantification. Transferring these detailed three-dimensional plans accurately to guide the actual surgery has been a fundamental challenge.
That's where advanced technology comes in. Computer-aided design for three-dimensional planning and printing is already well established in human medicine across various specialties, including orthopedics. It's particularly suited for bone deformity correction because bone is easily segmented from computed tomography data. This technology allows for printing bone models for practice, performing virtual corrections, and creating custom patient-specific guides designed for use during sterile surgery. While some successful clinical outcomes have been reported using these guides in veterinary cases, more robust scientific examination is needed.
Absolutely. This study aimed to rigorously compare the accuracy and reliability of radial osteotomies performed using these three-dimensional patient-specific guides versus a traditional freehand approach. They tested 3 different types of osteotomies, ranging in complexity, on normal ex vivo canine thoracic limbs.
The study found that overall, the mean angle deviation for all osteotomies performed with three-dimensional patient-specific guides was 2.8 degrees plus or minus 2.8 degrees, which was less than the mean deviation for the freehand osteotomies, which was 6.4 degrees plus or minus 6.0 degrees. This suggests the guides generally improved accuracy. The biggest differences were seen in the most complex type of osteotomy tested, the single oblique plane osteotomy. In this group, the freehand osteotomy deviation was significantly greater than the guided approach in both the frontal and sagittal planes. When looking at the combined deviation in 3 dimensions for this complex osteotomy, the freehand group also showed increased deviance compared to the guided group. The researchers established a clinically acceptable threshold of being within 5 degrees of the target angle. Overall, 84% of the osteotomies performed with three-dimensional patient-specific guides were within this 5-degree deviance from the target, compared to only 50% of the freehand osteotomies.